Hello, welcome to this NMC OSCE video where I'm going to talk through the implementation station with you. My name is Hannah. I'm an experienced UK registered nurse of 20 years and a university lecturer, and I've been a lead OSCE trainer as well. And I'm just sharing some of my information really around the OSCE to help you be successful, to help you if you're studying by yourself, so you don't need to pay for really expensive test centres as well, and to really support you in reaching your UK nursing career goals. So we're going to go over and look at the implementation station. Okay, so remember your implementation station is one of those 4 stations that make up your APIE, so your assessment, planning, implementation and evaluation. So you'll have the same patient condition as you had in your assessment and planning, and you'll be asked to administer the medications for them. So this is a 15-minute station, and it involves you safely administering medication, and it's always oral, so tablets, also it's oral medication in the stations, no injections or IV medication administrations. And like I said, you'll be given a scenario. It will be your same patient that you had in your assessment and planning, and you'll be asked to administer the medication for a certain time. So for example, please administer the medication for 1200 hours. There's 2 different medication drug charts. So there's one for a hospital-based setting and there's one for a community-based setting. And you can find those medication charts in the supporting document PDF, which is on the NMC OSCE website. And there's just really essential steps that you must demonstrate to show safe and competent practice in the station. And it has one of the stations which has one of the higher fail rates. And normally just because things are not verbalised clearly, especially around the reading of your prescription. So like I said, this station is testing that you are safe and competent to administer medications and you understand why you are giving them. Okay, so that's really important. You'll need to verbalise each part of the process so you can demonstrate this to the examiner. And you are required to have a good overview of common medications, so you do need to be familiar with key medications for key conditions and what they are for. And the whole of this station is really underpinned by you demonstrating the 6 rights of medicines administration. And in order to do that, you need to be verbalising these 6 rights, and you need to be demonstrating that within your practice. So checking you've got the right patient. I always add in the allergy check, it's that extra right here. Checking you've got the right medicine, the right dose at the right time, the right route and the right documentation, so in terms that your prescription is clear, valid and legible. So the equipment that you'll have available in your OSCE, so you'll have a drug trolley, like the one in the picture, or if your APIE has been set in a community-based scenario, you'll have like a clear plastic box. You'll have access to the BNF, so I'm going to talk through the BNF in this slide presentation. This is where you can look up your medications, so you'll have access to this on an iPad, and you'll be able to look up any medications which you're unsure of during the station. You'll obviously have your drug administration chart, and most of the medications come in these little brown bottles that you can see on the screen. A really top tip is they have a child safety lock on them, so you need to push down the lid hard and then twist, okay, and that will enable you to get into the bottle. So with all my OSCE training, I like to try and break the stations down into kind of different parts so we can have a bit of a mental mind map of what we're going to do when we start that station. So I break your implementation station down into 5 different parts that we need to complete. So first is key principles, okay, so that's your checking it's safe, maintaining privacy and dignity, doing your hand hygiene as per the 7 steps, introducing yourself, checking your patient's ID, okay, checking their allergies and gaining consent for what you are doing. So it's key principles every time with every station. The next section is going to be reading your drug chart correctly. And this is one of the biggest areas where candidates fail because they don't read the drug chart correctly. The next stage is then dispensing your medication, so getting your medication out correctly and doing the correct checks and verbalisation. Step 4 is then administering your medication, so giving that to your patient, explaining what that medication is for, and getting their consent. And then the final part is documentation. It's absolutely essential you have enough time in your station to properly and accurately document the medications you have given, and any medications which you've decided not to give in or admit. So key principles then, so again, start your station off, same as those key principles for your assessment station, checking that it's safe, ensuring privacy and dignity. You're going to decontaminate your hands using that 7-step technique and verbalising each part of that. You're going to introduce yourself using hello, my name is. You can ask your patient their preferred name as well. That's a nice patient-centred thing to do. And then I'm going to do that ID check. Okay, so I'm going to verbally ask the patient to confirm their name, date of birth. Okay, and I'm going to check that against the wristband and the documentation. If you're in a community scenario, you're not going to have a wristband. So you're going to check verbally the name, date of birth, just against your documentation and your drug chart. And we're also going to check the hospital number. So if we're in a hospital setting, we're going to check the hospital number against the hospital wristband and my drug chart and my documentation. And if I'm in the community, I'm going to confirm an address, so the patient's address. Okay. And then I'm going to do an allergy check. So I'm going to ask the patient if they've got any allergies, what reaction they have. And I'm going to again check this against my medication record and make sure that matches. And also your patient should be wearing a red wristband in your OSCE if they're allergic to anything. And written across that red wristband will be the thing that they're allergic to. So it might say penicillin. So it's important that you acknowledge that red wristband. This is really key and can be an area of fail. Candidates can check the allergies, check the documentation, but not acknowledge that red wristband. So really important step there. Then I'm going to explain the procedure to my patient and gain consent. Now, I think it's really good practice before you start looking at your drug chart is to check if your patient is comfortable. So are they in any pain and do they feel sick or nauseous? And I teach my candidates to do this because when you come to your medication chart, if your patient is written up for painkillers, analgesics or anti-sickness medication, you know if you're going to need to get that medication out. Okay, so just check your patient if they've got any pain. If they have got pain, do a quick 0 to 10 assessment scale, so you know the severity of that pain, so you know what level of analgesic to get out if they want that. Okay, check that they're happy swallowing tablets and they don't have any swallowing difficulties. And then you're all set up then to move on to reading your drug chart. So reading the prescription chart is an absolutely essential part of this station, okay? And you need to read, firstly, all the details on the first page. You're going to read that chart top to bottom, I'm afraid. So I'm going to confirm the name, date of birth, hospital number, patient's height, patient's weight, which ward they're on, which consultant, when they've been admitted, their date of admission. I'm going to read through the allergies. I'm going to read through any medication risk factors. Okay, so that's really important. And then I'm going to read each part of the drug chart. So I'm going to move on to the second page. And again, I'm just going to read the name, date of birth and hospital number. And that's absolutely fine. You don't have to read all the height and the weight for all the pages. So I'm just confirming that this page of the drug chart does actually match my patient. Okay, that's a safety issue and that's why we would read and confirm that. So I'm going to read the name, date, name, hospital number, date of birth. Okay, I'm going to confirm all the other details are correct. And I'm going to look through this chart and identify the medications that are due at my time. Okay, so you don't need to read out the whole prescription for medications which are not due at your time. Okay, so if I come to this page of my medication chart, I'm going to confirm the patient's name, date of birth, hospital number, read those out loud, confirm that they're the same. And I'm going to read on to reading my regular medications, okay? So I've been asked to give medications at 12, so I can see this medication is due at 12. So I'm going to read the full prescription, okay? And what I mean by reading the full prescription is reading everything in that box out really clearly and then confirming that prescription is clear, valid and legible. Okay, if any information is missing off that prescription, then it is not clear, valid, and therefore I can't give that medication. Okay, so these are the legal requirements you need to verbalise and demonstrate that prescription is clear and valid. Okay, so I'd come to this medication. I'm going to say my drug is paracetamol. The date is today. The dose is 1 gram. The frequency is QDS, so 4 times a day. The route is oral. The duration is ongoing. The time is due at 12 o'clock and it was last given at 6 o'clock. The start date is ongoing. The finish date is ongoing. I've got a prescriber's signature and bleep, Dr. T tip, and the bleep is 600, and it's prescriber's name of Dr. T tip. Now I confirm that this prescription is clear, valid and legible, and the medication is due at my time. So I'm going to dispense and administer this medication. So you need to read through every part. So the drug name, the date, the dose, the frequency, the route, the duration if it's there. But if that's not there, you can still give the medication, the time, and confirming that is the time when you have been asked to give medications. You must check the start date and the finish date, okay, and check that those are within the time frame of when you are giving the medication. You must confirm the prescriber's signature and bleep and that they've printed their name. And if all those components are there, you then confirm this prescription is clear, valid and legible. If anything is missing, a route, a time, a start date, a frequency, a dose, the prescriber's signature, then you cannot give that medication. That prescription is not valid, okay, and it's not clear or legible. So you need every medication that's due for the time which you've been asked to give medications, you need to read out the full prescription, okay? Now, what you'll find more recently is there are lots of medications on your chart. So you might have 3 medications due at your time. Normally it's a maximum of 3, which you have to give in your station. But lots of other medications written up which are not due at your time. Now, you do not need to read out all those other medications. You don't have time to do that. But just really clearly verbalise to the examiner, none of these other medications are due at my time. Or it could be all these other medications have been given already. Okay, so just be really clear about that and why you're not giving them. Okay. So like I said, you've got to systematically go through each prescribed medication, which is due for your time, and read out the date, the drug name, the dose, the time of administration, the route and method of administration, the start date and finish date, the signature of the prescriber, the bleep, and which is their contact number, bleep, if you're not familiar with that term, and then verbalise that the prescription is clear, valid and legible. This is really important to pass your station. So once you've identified, so read through your whole drug chart, each page, confirm the name, date of birth, hospital number, read out the full prescription of medications due at your time, verbalise why you're not giving any other medications, okay? Watch out for things such as medications written on the once only, okay? So these are like stat doses, so sometimes medications are written up there as well. Look out for your as required medicines. So your as required medicines are only if the patient needs them, okay? So they won't have a time next to them, and sometimes that throws nurses when they go up because they're looking for that time. They don't have a time because they're as and when the patient needs them. And they're normally things such as pain relief, anti-sickness medications, which is why it's really good to ask at the beginning of your station if the patient's in any pain or any sickness. You know when you get to those as required medications, then you will be able to administer those, okay? So once you've read and confirmed your drug chart and your prescription, you're going to go and get your medication trolley. I do a hand hygiene here because you're going to go into a communal medication trolley, okay? And then you need to get your correct medication out, and you need to verbalise this and check in that what you're getting out of the drug trolley or the box, the name of the medication, the dose of the medication and the expiry date. So I'd go to the trolley, I'd say I've got my paracetamol, and I would show that I'm matching that against my prescription. Okay, so very systematically, check my prescription and double check. So I'm getting paracetamol, I've got paracetamol prescribed, I've prescribed 1 gram, I've got 500 milligram tablets, I need 2 tablets, and the expiry date is 01/28, for example. So you must verbalise how many tablets you're getting out. You won't have a calculator, but it will be simple maths, so maybe 2 or 3 tablets you may need to get out, or 1 tablet. So you just need to be confident with that, okay? Don't forget to verbalise the expiry date. As you found your medication, there'll be some white paper little cups, okay? You want to dispense separate medications into separate cups, okay? Don't just get 1 cup and put all your medications in there, okay? That's really unsafe practice. If you're patient actor only took like 3 tablets out of all your tablets and gave you the rest back, you wouldn't know what they've taken. Okay, so separate cup for separate medications. Use a non-touch technique, so don't use your hands. Tip your medications into your pot. Take your time. When you're nervous, you know, our hands can jutter and medications can end up being dropped. Okay, if you do drop a medication, just verbalize to the examiner you would dispose this as per pharmacy policy. Don't put the medication out with your hands. Don't put it in the bin. Don't put it back in the pot. Okay, that's really important. So you have to always use that non-touch technique. Once I've got all my medications out onto my tray, I'm going to return to my patient. I'm going to decontaminate my hands because, again, I'm coming back to the patient. And it's really important that you do a second ID check, okay? So this is trust policy and a lot of trusts as well. Because I've left the patient get my medications, I'm coming back. I'm going to ask for a final ID check. So I'm going to ask them their name and their date of birth. And I'm going to check this against the wristband and my medication chart. And then also check the hospital number, okay? You need to explain to the patient what each medication is for, and you should give them one key side effect, and this is so they can make informed consent about taking that medication. So this is why I said it's really important to know your medications, and if you don't know any, you must look them up using that electronic BNF, okay? Because nurses will fail if you don't give the correct explanation of that medication, okay? Offer the patient some water and then check that they've swallowed the tablets. So the BNF you can access through Google. Okay, there is an app which you can also download to your phone. Okay, so it's the British National Formulary and it contains all the medications which are licensed to give in the UK. It gives an explanation of what they're for, the dosage and side effects and contraindications. So if you're studying at home, it's really important to look that up, okay? And there's key medications in the OSCE which you need to be familiar with, you know, antihypertensives, diabetic medications, and antibiotics, you know, just examples of some of those. Then your final bit of your station is your documentation, okay? And this is essential, okay, to pass the station. So you need to leave enough time to get your documentation done, okay? So you can only sign your medication drug charts once the patient has confirmed they've taken the medication, okay? Do not mark or sign that drug chart before they have swallowed. This will be a critical fail, okay? So leave time to do your documentation. Be clear on how you document, okay? So a signature in the box, okay? If you're giving an as required medicine, then you need to put the time and your signature, okay? And on the very front of the drug chart, there is a box with where you need to write the person who's administered the medication. So you write your name, your signature and your base. So where you're based. So wherever in that scenario it says you're working. So it says you're a nurse working on the surgical ward, you'd put the surgical ward, okay? So that front box on that medication chart is really important. And you'll see that it sits under the prescriber's signature box. There's a box there. So although this station is assessing you on when to give medication, there will also be times where you should pick up when it is unsafe to give a medication, okay? So there might be some deliberate things on your medication chart for you to notice and realise it's unsafe to give a medication, okay? So firstly, if any part of that prescription read-through is incomplete, so that it's missing a signature, prescriber signature, a route, a time, a dose, then you cannot give that medication, okay? You mustn't alter the prescription, you must just document that it is incomplete using the codes, which are on the second page of the drug chart, and completing the admitted medicine box as well, okay? Watch out for a patient that is allergic to a medication, normally an antibiotic, and they have been prescribed that same antibiotic or an antibiotic from the same family, okay? So, for example, a patient that's allergic to penicillin would be allergic to all the medications that are based or contain penicillin, so flucloxacillin, amoxicillin, ampicillin, co-amoxiclav, okay? So this does come up quite often in the OSCE, so they would have deliberately written up the patient for a medication which they were allergic to, and you need to recognise that and not give that medication, okay? Also, it might be a time when it's clinically unsafe to give a medication. So, for example, the patient's blood pressure might be low or the pulse might be low. So if you've got medications that are written up for blood pressure or rhythm control, heart rate control, you need to check with the examiner before you give that medication for a recent blood pressure or recent pulse, okay? And if that is low, significantly low, so blood pressure less than 100, or a pulse less than 50, then you would have to withhold that medication, okay? Also watch out if a stat dose, so a once only dose has been given on the drug chart, so on page 2, okay, and also a regular medication of the same is written up as well, okay? So check if there's a stat dose given, you can't and the time frame hasn't been enough. So for example, if a stat dose of paracetamol was given at 5 in the morning and you've been asked to give medications at 6 in the morning and you had paracetamol as a regular dose at 6 o'clock, you couldn't safely give that medication, okay? And just if there's any contraindications, so look out for things such as, ibuprofen prescribed for your asthma patient, that's contraindicated. Blood thinners such as warfarin in my patient who's had a subdural hematoma. So just be aware of those contraindications. You do need to document those, and I'm most probably going to do another video on documentation and looking through the drug charts as well, okay? So if you're not given a medication, you do need to document it with a code. And on the second page of the drug chart, it's got all the codes listed there in a box, okay? So you don't have to remember them, you need to be familiar with them. You need to document the codes, okay? And on the back of the chart, there's an admitted medicine box, which you need to document as well, okay? So my top tips for station, so time management is key as well, okay? 15 minutes goes really quickly. You need to be really familiar with your drug chart and what you're looking for. Quickly identify medications that are due at your time and just verbalise that none of the other medications are not due, okay? Don't waste time reading out prescription charts for medications that are not due at your time, okay? Must remember to do your patient ID and allergy checks and take valid consent. Absolutely essential, or it's a critical fail. Read your drug chart systematically, okay? So each box, so drug name, date, dose, time, frequency, prescriber signature, and bleep, prescriber's name, start date, finish date. Read that out really clearly, okay? Verbalise that the prescription is valid and clear, okay? Verbalise what medications you're giving, which ones you're not giving and why, okay? So if there's a medication not given because of contraindication, you need to verbalise this is because the patient is allergic and I'm not going to give this medication, and that you would escalate this to the medical team, okay? Any medications that you're not giving and because there's a contraindication, you need to say that you would then go on and escalate that with the medical team as you would do in practice, okay? Clearly explain what each medication is for, and if you don't know, you will need to look it up in the BNF in your station, okay? Otherwise, that will be a critical fail. Make sure you're dispensing correctly, so checking and verbalising the name of the drug, the expiry date, and how many tablets you are going to get out, okay? Keep an eye out for those medications which you should not be administering, okay? So especially patients that are allergic to medications, okay? So look out for those. The NMC are looking for you to show safety and also clinical knowledge, okay? So you can't go in and be a robot, just read off the whole drug chart and give whatever is prescribed, okay? Because there will be things there to catch you out, okay? Sign your drug chart as soon as the patient has taken the tablets and not before, okay? Be familiar with your correct documentation, how you do your documentation. Don't forget to sign the front box, okay? And don't forget to write down any admitted medications in the admitted medication box on the back, okay? And just finally, don't forget your hand hygiene, start and finish, and before you go into your communal drug trolley and when you come back to your patient. So I hope you found this video helpful. Implementation station is really big, lots and lots of information. Okay, I'm hoping to do a couple more videos looking at the drug chart, looking at admission codes. Okay, I'm also available for one-to-one and small group online tutoring. You'll get access to recorded lectures, access to all my teaching resources. I've got APIE scenarios for all the 12 patient conditions, care plans, professional values, evidence-based scenarios, other supporting information guides such as how to do your documentation, okay, as well. Common medications that are used in the OSCE as well. I've got a list of those. Those do change as well. Yeah, so available online. You can, once you have all the resources and know what you're doing for each station, it's really easy to prep at home, okay, and successfully pass your OSCE without paying hundreds of pounds for a training centre as well. So feel free to drop me an email, hannah.l.ames@outlook.com, or you can visit my Facebook page, Nurse Tutor Tutoring with Hannah.